Okay. In a previous video, we talked about many of the features of this model itself, without this the part of the intestines with it, and also the pancreas and the duodenum and so on. So here we wanted to show you the actual position of this sample. If we take it out, first we want to talk about this, and we have some things left there. Inshallah, we'll talk about it in this video. Yes, so first, we couldn't find the stomach model. It would have been much nicer. But anyways, this is the beginning of the duodenum, okay? It's passing in a C-shaped format to the right, and then back to the left as it terminates at its junction of the jejunum, okay? These are the folds of the jejunum and ileum. So it's located near here, its junction. Okay, around here. These are the plica circularis. Okay. This is the entrance of the bile duct. And here, of course, this is the major duodenal papilla. This is the ampulla vater. And there is a thickening of muscle to form the sphincter of Oddi. Okay? So beware of any of the detail. This is the papilla. This is the ampulla. And this is the sphincter, this region. Okay? If we put the back for just the origin of this bile duct, and we can also bring the liver. Of course, we talked about the liver previously in another video. So here, imagine it. This is the bile duct. And now imagine it. Here, this is the bile duct also. Okay, so this is the bile duct going down into the duodenum, and it's mainly this bile duct that actually determines the separating line between the foregut origin of the duodenum and the midgut origin of the duodenum. Okay, this is the portal vein. It's formed from the superior mesenteric and splenic. And the splenic, this is the splenic itself, and it receives the inferior mesenteric. This is the superior mesenteric artery. Again, we said because of the origin of the pancreas, it passes behind it, except, it's not visible, except for the uncinate process. You can see it's going anterior. This is anterior, so it's the pancreas. You can't see the superior mesenteric artery because it's behind the pancreas, but at the uncinate process, it passes in front of it. It's just the uncinate process of the pancreas. This is the body of the pancreas and the tail of the pancreas. Where is it going? It's going to the spleen. It's reaching the hilum of the spleen. Also has embryological origin. And other features in this aspect. Okay. Yes, the ducts. This is the main pancreatic duct. All right. Of course, it joins the bile duct and then enters into the duodenum. And this is the accessory pancreatic duct if present. And of course, for the name of the ducts, this is the main pancreatic duct of Wersen, and this is the accessory pancreatic duct of Santorini. And again, if we discuss the embryological origin again, when the ventral bud rotates posteriorly, the whole duct of the ventral bud forms this part of the main pancreatic duct. And the distal part of the dorsal pancreatic duct forms this part of the main pancreatic duct. So in about 10% of people, they fail to fuse, so you have this accessory pancreatic duct as the proximal part of the dorsal pancreatic bud, okay? And the intestines. This is the mesentery. This is the transverse mesocolon, by the way, in case we forget it later. Here we have the junction with the ileum. This is the ileum, it's not the appendix, okay? The ileum opening into the large intestine. So this is the cecum. This is the opening of the appendix. Remember, it's caudal. It's initially caudal and becomes posteromedial, but it's still caudal. Here's the appendix on the right side. And of course, the tinea coli is supposed to merge here and disappear. It's kind of disappeared. But it's obvious, it's the appendix. In this case, we can say it's retrocecal. Then And these are the plica circularis of the ileum. They disappear in the large intestine. You don't have plica circularis. And what we forgot in the previous model is that the large intestine has hostrations or circulations. Okay? And we also mentioned that it has tinea coli, which is the thickening of the muscularis externa. Okay? Okay, this is the ascending colon. This is the hepatic flexure, or the right colic flexure. This is the transverse colon. This is the splenic flexure, or the left colic flexure, or junction. And this is the descending colon until it terminates at the sigmoid colon. So here, this is the sigmoid colon, S-shaped or whatever. And its tinea coli terminates at the rectum. There's no rectum in that sample. Okay? As for this is the greater omentum, of course. And because the greater omentum is also supplied by omental branches, and meaning epiploic branches, omentum is epiploic. These are supposed to be branches of left gastroepiploic artery. Because as the name suggests, gastroepiploic means supplies the stomach and also the omentum. And behind, again, this is the right side. This is the right side, and the right side is mainly supplied by the superior mesenteric artery, left side mainly by inferior mesenteric artery. So this is supposed to be the superior mesenteric artery. And in this sample, it's actually much better than the other because it's higher up than the inferior mesenteric. And it's given off, as we can say, this is the middle colic, and this is the, as we can say, the right colic, the ileocolic, and this is supposed to be the continuation that should anastomose or the ileocolic. Of course, the jejunal-ileal branches are not obvious. They are supposed to come anteriorly. And this is the inferior mesenteric artery, at the level of L3 it arises, given off the left colic, the sigmoidal, and the superior rectal. This is not rectal, but anyways, let's say this is superior rectal. Okay. And okay, this is basically what we know of this sample. I can't think of anything else. And a few things left from this sample. As I said, we've already explained this, but some things we have forgotten. This is the median sacral artery going down. Okay. These are the lumbar arteries arising from the aorta. Okay. So the lumbar veins draining into the inferior vena cava. And just, yes, we also forgot the psoas minor muscle. Here it is. And also on this side. It's a variation. Not a variation, but not, many people have it. And this could be the internal iliac, I don't know, divided into branches. I haven't taken the pelvis yet. And that's it, maybe. And one final thing is these superficial inguinal lymph nodes. And below the level of the umbilicus, all the lymph from the abdomen drains here. Okay?